Hello, my name is Anna Yatskevich. Nurses often have many opportunities to reflect on their contributions to patient care outcomes during clinical experiences. In this video, I will be reflecting on the capstone project as well as the intervention I presented that was based on PCOS. After meeting with and interviewing my friend Mary, who has PCOS, and learning about her story and diagnosis, I created an intervention of an educational brochure. This brochure outlines the most important topics related to PCOS. These topics include the definition of PCOS, its symptoms, how PCOS is diagnosed, treatment and management options, and community resources. The brochure is simple and uses words and phrases that are easily understood. The brochure is a great tool for healthcare providers as it helps them start the conversation with PCOS with their patients. It allows them to utilize the teach-back method, which ensures that the patient fully understands their condition. Many patients with PCOS often feel overwhelmed leaving their doctor's office as there is so much information given to them during the time of their diagnosis. By providing simple and easy to understand education, providers will be improving the quality of care they are giving and enhancing patient safety, as patients are more likely to be compliant with their care plan if they are adequately educated. Physicians must promote patient education and engagement through improvement of patients' health literacy. Health literacy is defined as the capacity to seek, understand, and act on health information. By utilizing methods such as brochures and the teach-back method during education, patients' health literacy will improve, which leads to better patient outcomes and enhanced safety. Evidence-based practice documents were used for the duration of the capstone project. These documents discussed the various treatment options for PCOS, as well as explained the physiology behind the condition and its various symptoms, such as a difficulty to conceive. When presenting the findings to the patient, Mary found the evidence extremely interesting and stated that she learned something about her condition that she did not know before. All the evidence was used as a guideline when creating the educational brochure for the intervention portion of the capstone. One specific source that was helpful in developing the treatment and management section of the brochure was Effectiveness and Safety Assessment of Drosophrenone Ethanol Estradiol Tablet in Treatment of PCOS Patients, a single-center prospective observational study. This article discussed the hormonal issues that come with a PCOS diagnosis and its possible treatment options. The article discusses that currently, best practice includes use of fourth-generation combined oral contraceptive therapy. The goal of this treatment is to help women regain a regular menstrual cycle and to improve the clinical signs of hyperandrogenism. This evidence is consistent with what is being seen in nursing practice today. Many women who have experienced symptoms of PCOS are prescribed oral contraceptive therapy by their physicians. This can be seen with Mary, who has experienced symptoms such as menstrual irregularities and acne. Her physician has recommended oral contraceptive therapy, which has aided in managing the irregular menstruation as well as the acne. Healthcare technology was used in this capstone project in order to improve outcomes and communication with the patient. For starters, due to the COVID-19 pandemic, meeting with the patient was not always an option. To bypass this, video calls were made, which promoted safety and still allowed for an interview to occur. In addition to this, a portion of the capstone project focused on nursing informatics. Nursing informatics, or NI, is a specialty in which nursing science is combined with analytical science to improve outcomes for patients and enhance clinical workflow for healthcare providers. NI is essential as it helps to identify, define, manage, and communicate data pertaining to nursing practice. NIs are an immense benefit when considering the treatment of women with PCOS. NIs utilize problem assessment, solution development, implementation, and evaluation in order to improve patient outcomes. NIs can do this by making data, such as comprehensive research studies, more accessible for all members of the interdisciplinary team. Collaboration with NIs significantly helps medical professionals to stay educated on the most current healthcare trends, technologies, and techniques related to PCOS. With the help of NIs, healthcare providers would have an abundance of information at their disposal. This information can aid in the rapid identification of possible risk factors and provide healthcare providers with recommended treatment options that are based on data from thousands of other patients with PCOS. This would be a significant benefit for patients with PCOS. As mentioned throughout the Capstone project, women with PCOS can be extremely difficult to diagnose and manage. With the help of NI, diagnosis and treatment options would be available much quicker and be based on evidence, leading to better outcomes for the patient. Health policy also influenced the planning and implementation of this Capstone project, as well as made contributions to policy development. This project was focused on women's health, so the Affordable Care Act, or the ACA policy, was utilized. This policy was very beneficial in developing an intervention as it focuses on women's health and providing them with accessible treatment and education. The ACA lowered the cost of healthcare for many women and improved the quality of the healthcare women receive. These improvements included education and access to services such as annual mammograms, annual well woman visits, birth control, and breastfeeding support. The ACA also prevents women from being denied health insurance coverage because of a pre-existing women's health condition. This includes things such as breast cancer, PCOS, pregnancy, and depression. This policy plays an important role in developing an intervention for PCOS. The ACA helps women have access to medical care they may not have had before in the form of physician visits. At these visits, women are able to get educated on their condition as well as get information on how to better manage it. This is an important factor to consider as many patients with PCOS are severely lacking education on their condition. Policies have an immense effect on women's health, especially women who have PCOS and need a multitude of medical services. For this reason, ensuring access to non-discriminatory healthcare coverage, ensuring access to a broad range of evidence-based services for reproductive health, and supporting public policies that positively affect women and their families are essential to improving the overall health and well-being of women in the United States. The Capstone project outcomes definitely surpassed my initial predictions. Initially, my predictions were that for the duration of the capstone, I would learn a lot about PCOS. Not only did I do that, but I also learned how PCOS relates to quality, safety, cost considerations, technology, care coordination, and community resources. I was also able to create an educational tool that is a great benefit for patients who have been diagnosed with PCOS, as well as for providers who want to start the conversation about PCOS with their patients. Overall, the outcomes for the Capstone project were increased education and improved patient outcomes. Over the course of the Capstone project, there was a lot of personal and professional growth. Personally, I learned how important it is to include the patient in every aspect of the healthcare process. They are a valuable member of the healthcare team, and their opinions should be greatly considered when developing a care plan, as well as a treatment and management plan. Professionally, I learned the importance of research and reliable evidence. This project, as well as the program in general, helped me to develop my research skills, as well as my skills to evaluate evidence. I am confident that these skills will aid me in my future endeavors and assist me in any future education programs. Finally, I learned how to improve the quality of care that I give in order to improve my patients' outcomes and to provide a better experience for them. I believe that this capstone as well as program has helped me to grow as a nurse and will continue to grow me personally and professionally in the future.